Welcome everyone to the, I think the first CKD Clinic Network meeting of 2022. Glad everyone could join. With deepest gratitude, I reflect that I live and work on the traditional unceded and territory of the Musqueam, the Squamish, and the Tsleil-Waututh. And today I'm here in Vancouver, where there are cherry blossoms and snow from overnight. So always beautiful in different respects. In terms of housekeeping, I think we have over 35 people on today. So if you have questions, the chat is open, and maybe use your hand after for questions, and we will hopefully have some time for a discussion. Today, we're going to talk about a website called My Kidneys, My Health, and I'm really excited that there's lots of people on so we can start to hear about how to disseminate this in our clinics. And we're very fortunate, and I'm fortunate to have heard Mo speak before. Dr. Donald has spent a lot of time reflecting and thinking about this, and wants to talk to us today about a website that has been developed by patients and for patients. And so we're going to turn over to you, Mo.
Thanks a lot, Monica. And I'll let whoever's running the slideshow. Thanks, Sabrina. So thanks, everyone, and thanks for this opportunity to present to you today. I'm very fortunate, next slide, to be presenting from Calgary, and it is where I reside and play and work in this beautiful terrain we have just outside Calgary with the Rocky Mountains. And this is the Treaty 7 territory and also the Métis Nation of Alberta, Region 3. Next slide, please. So some of you might have recognize some of the information I'll present today in terms of the background of this work over the last few years. And then, as Monica mentioned, we're going to talk about My Kidneys, My Health, this website.
We're getting a little bit of feedback, so if we can just mute.
And then discuss the implementation and dissemination of this website and any questions and answers. Next slide, please. So today, we hope that you'll leave here and be able to explain what My Kidneys, My Health website is, who it's for, how it can help support patients and those that care for them to self-manage their CKD. But also want to have time to share your ideas of integrating this website into your clinical practice, thinking of ideas, some of the barriers, some of the facilitators that may be out there for this integration. Next slide, please. So we're going to start with a few polling questions, and I think Selena is going to set that up and before we begin the main part of the presentation. So these are the questions that you'll be getting. Thanks, Selena.
Sorry, I'm just going to see if Amanda or Graham can launch the poll from their end.
Perfect. So while you're waiting, you can see.
There we go.
Oh, here we go. Thanks. So the first question, have you heard of My Kidneys, My Health website prior to this presentation? And this, perfect.
And if others look like mine, I think the second question was supposed to be, have you used it in clinical practice? Yeah. Is that right? So we'll answer both and submit.
Perfect. Thanks. Thanks, Monica, for pointing that out. Okay. I think things look pretty, still a few votes coming in. Okay, and so now can we just present the results? Can you present them in a final form? Okay, just looking at the results here, we could see that 55% have heard about it, with 39% have not. So this is great for those people that have not heard about it. And then if you're using it, and for the yes, 32%, and choice 2 is 68%. So there's a lot of, I'm hoping to cover the site itself today, as I mentioned, but also it'd be great then to see, going forward, some ideas about integrating it into clinical care. Next slide, please. So we'll start with that project background. Next slide. So overall concepts, we're back about 7 years ago. There was a consensus or a research priority setting project for patients with chronic kidney disease. And basically one of the top 10 research priorities were around the need to support and have resources that patients could use that have CKD to individualize their unique situation, priorities, and preferences. And so this is where this work came out of in terms of getting support financially to do this as one of 18 CanSolve projects to look at self-management and supporting patients with chronic kidney disease. We know that self-management has been shown to slow chronic kidney disease progression and improve quality of life for those living with the disease. Next slide. So I want to introduce you to our current patient partners. So we've been very fortunate to have up to 6 patient partners, which have been patients or caregivers that have lived experience with chronic kidney disease. And currently we have 3 patient partners working with us. And that is Lucy, as you can see up to the left of your screen. Lucy works full-time and she lives in Vancouver, BC. We have Paul Watson. He also lives in BC, and he joined our group just over a year in early COVID, I guess. And you should Google Paul Watson if you're interested in adventure. And he is also gets accolades as he was a reporter through many war-torn zones. So he has written a few books, and so he's an interesting character, but also we're very happy to have him join our team in the last year and a half. And we have Dwight Sparks, who comes from the East Coast in Newfoundland, and he is part of our work, but also he's a key member of other projects within the CanSolve CKD network. And so we're very grateful to our patient partners, both the past and current patient partners. And so a lot of this work, and I should say a lot, most of this work has been guided through the 6 to 7 years by our patient partners. Next slide. So I just want to give you a quick overview. Some of you probably know this work inside out, but just for those that don't know our phases of research over the last few years has been, we started with trying to understand what is in the literature in terms of supports and primary research around self-management and chronic kidney disease. So we did a scoping review, and that is published. We also wanted to know what's happening on the ground in CKD clinics across Canada. So we did an environmental scan where we sent out a survey, and some of you on the in the session today may have answered that survey to ask, what do you do locally to provide self-management for patients and those that care for them? And that is also published. We moved on from that, identifying that the next steps were then to identify what patients and their caregivers thought they needed. So we knew there was a need for this area of self-management and support and resources, but we wanted to dive a little bit deeper, and we did focus groups and interviews with patients and caregivers across Canada, and asked them questions around their experiences living with chronic kidney disease and the types of supports and needs that they had to self-manage their disease. From there, we took that information and had a one-day priority setting consensus workshop here in Calgary a few years ago, and try to identify, okay, these are the needs that patients have identified. We see gaps in the literature regarding these needs. And what we did was sat down to identify, okay, what are the areas that need support, be it content, how do you want that support, and like by who, when, all those kind of questions. And so that's what we determined at the end of phase 2, that it would be an electronic health tool to build. And so we went into phase 3, but before we started building this electronic health tool for CKD self-management, we did another scan of all the websites out there to understand maybe there's something out there already that we just don't know about, or patients could tell us about that they would use. And what we did was identify those websites that support CKD self-management. And then we looked at the based on tools that rate their credibility, the amount of information they provide, And we also published that. And we found that our patient partners noticed that there's still a gap. There's a gap in what's in the literature. There's a gap in what's out there for electronic health tool. So we led to go, okay, our next step is to co-design a tool to support patients with CKD. And I should jump in right now and just clarify, this tool that was identified was around early stages or early categories of CKD or newly diagnosed patients. And those groups found that that's what they found missing to meet their needs. And so, as we know, and we'll talk about this a little bit later, is these patients that mostly, and their care is mostly in primary care and obviously general nephrology, CKD clinics when they're in those early stages of their disease. So phase 3, we built a co-designed this e-health tool that is now labeled My Kidneys, My Health. And that name came from, we had a call for naming the tool that went out, and that was the one that was voted across Canada to go with. So then we moved into phase 4. So now we had this tool that was co-designed by patients for patients. We did all the classic tool development, usability testing. So what we consider heuristic, does the navigation work, what's missing? But then we wanted to, before we went live with it, we wanted to do a preliminary evaluation to understand how this tool will really work in the real life. So we did what we call the preliminary evaluation to look at its acceptability, things that people would say they would change or what they liked and didn't like about it, but also ideas around how to implement this into everyday care in terms of from the perspective of a patient. So that was 8 weeks of patients having the tool at their disposal. And we are currently resubmitting a paper with modifications for publication on that. Finally, I'll talk a little bit more detail about this phase 5, but basically we're in this phase now where, great, we have this tool that's out there for public consumption, but we're really trying to understand implementation and how to build strategies to implement this into clinical practice. Next slide, please. So before we get to the tool itself, this is basically a schematic that was developed by our patient partners when we got the qualitative back about understanding what are the needs and preferences and supports for patients with chronic kidney disease. And basically, they described it as a roller coaster journey, that they want to live well with chronic kidney disease, that these buckets or carts on the roller coaster represent the areas that they really need more information on. The struts represent the supports that help them get through this roller coaster ride. So practical, tangible supports, and that's where this e-health tool concept came out. CKD information sharing, again, about how and when would this information be available to them. And then the people on the ground there were considered their support. So to your left of your screen, the healthcare providers as a key support. In the middle of your screen, that the community, be it their church organizations, their social groups were supports in this ride, and also obviously their family as supports. Next slide. So let's talk about the My Kidneys, My Health tool. And we're going to show you a quick video just for those that may have not had a chance to see the tool and highlights of the tool itself. Next slide with the video. Oh, before we get to the video, what is My Kidneys, My Health? I just want to reiterate, it's a website, as Monica said, designed by patients for patients, credible, trustworthy information. So that information is either guideline-based, and if there is no guidelines, experts provided their information to make it evidence-informed in terms of the dietary, the social work information, all things that we didn't have guidelines around. There's interactive tools and resources on it, and a variety of formats, videos, visuals, text, audio. Next slide, please. And so basically, this is just a comment that was brought to our attention when we did the feasibility study. A patient said, I liked My Kidneys, My Health. Everything was under one roof. I found it was well thought out, that they had information about general kidney health, symptoms, diet, exercise, finances, things like that, all under one website, which is good. There were some things I thought were really good that I didn't know. For example, looking up different foods, and right beside it was potassium, phosphorus, which are two biggies for kidney patients, and listing of each foods, you know, how many grams. So I thought that this was a really good, because often it's hard to find that. And next slide, please. So let's I see Selena put the website.
My Kidneys, My Health provides credible and
Here's the video.
consistent information on topic areas identified by patients and caregivers. The websites can help you learn how your kidneys work and what causes kidney disease, about patient-friendly foods and how to read food labels, what medications are safe to take and which ones to avoid.
Sorry, I think the video is buffering a little bit.
My Kidneys, My Health provides credible and consistent information on topic areas identified by patients and caregivers. The websites can help you learn how your kidneys work and what causes kidney disease, about patient-friendly foods and how to read food labels, what medications are safe to take and which ones to avoid, what are the symptoms and how to manage them, about your mental well-being, about your physical well-being, how kidney disease may affect your finances and what you can do about it, about work and school considerations and resources, and tips on how to travel with kidney disease. As you go through the website, you'll see questions that you can add to your question list. By collecting these questions in your list, you can print or review the questions that you'd like to bring to your next visit with your healthcare provider. Another great interactive feature of the website is the My Food list. Here you learn about relevant nutrient content and serving sizes of different foods. And you can also search for food by nutrient content. By adding key foods to your list, you can access the information that you need when you need it.
Thanks, Sabrina. Next slide, please. So now we're moving on to that area of phase 5, the discussion around this implementation and dissemination of this website. Next slide. So basically, we are doing a true implementation study here in Alberta. And so the idea is, we know that this website was built by patients for patients, particularly those that are in the early stages of chronic kidney disease or newly diagnosed, and that primarily sit in the community, managed in the community by primary care professionals such as primary care physicians, nurses, social workers, pharmacists, but also in the general nephrology world too. And so in Alberta, what we're doing is interviewing clinicians from both urban and rural settings, and also physicians and allied health, and asking them, you know, what would make it easier? What are some of the facilitators to implementing this into their clinical care setting, barriers and facilitators to doing that? And then what we're doing is using in the background what I call where the magic happens. We map these to theoretical behavior change concepts and come out with strategies to help the implementation. So some of these strategies can be related to environmental barriers. So example that, you know, we don't have time, but hey, we do have like a video TV in our waiting room. That would be helpful if you could do a video and have it playing there for patients. Or some can relate to individual behaviors. Like I don't have a computer to show them it, or I feel that I'm not too sure about this information that I'm presenting. So we're looking at that currently currently in Alberta. And the idea is then implementing these strategies and then checking back with these individuals and organizations to see how they worked and didn't work. And the hope is, one, to specifically understand how to implement a patient-facing tool. So not a clinician supportive tool, but a patient-facing tool in clinical practice in these environments as primary care and general nephrology. And also take those concepts and see if they apply to other chronic diseases that where there's other projects or research that are trying to implement into the similar settings, and to see if there's any of these barriers and strategies that people can relate to and use and test them in their own work. Next slide. So our future work, as we mentioned, we're currently disseminating finding strategies to share the website overall. So we have our patient partners, those three I introduced to you earlier on in the presentation, leading this work. They meet every 3 to 4 months with the team members to develop dissemination strategies for the website. The implementation, which I just discussed, about finding these theory-informed strategies that to help integrate this into clinical practice. And then what we hope is then, if we're successful for future funding, potentially with CANSOLV network funds, that we will then look at gaps that I've identified both in our feasibility study and currently as we're going through with implementation and dissemination to meet needs of potentially diverse populations regarding self-management and peer support. So what we've heard, obviously the website's in English, any ideas about language or for the resources in terms of multi-languages being provided, things like that. So going forward, we want to make these changes based on the feedback we've been getting both in our research, but also in our in these kind of sessions where we talk to patients and clinicians. Next slide. So I guess why don't I start with any questions, and then maybe I can ask questions to the people that are attending. Is there any questions that people have about the website, its development?
Feel free to just use the reactions and put up your hand, and we'll see you right up. So Mo, I just had a bit of a question about those in real time that have been using it in their clinics. And I guess there were 39% on this call. So has there been kind of that real world feedback from patients, and what are you hearing for those that are using it in clinics? So that would be my first question. The second one was, I love that it's focused on early stage. And I wonder if I look at it with the lens of individuals that would not be supported by it. So in British Columbia, if you have a CKD clinic team, you have the full complement of people helping. You have dietitians and everyone. If you don't, you have the GP in private practice. So that's kind of the dichotomy. And we haven't done a great job in BC in non-specialist care, wrapping people with a multidisciplinary team. So my question is, if an individual is looking at it without that support to ask questions of a multidisciplinary team, do you see any difference in how it might be used by a patient that might not have those resources to check in with questions versus those that would be a CKD clinic patient that would then be looking at the website?
Good question. So the first one, Monica, what we've anecdotally heard back so far, it's interesting when we're recruiting clinicians to be part of the interviews for implementation to understand the barriers and facilitators. It's interesting to hear that one, they're not aware of it, which is understandable because we just started the dissemination process since well, I guess we shouldn't say we just started. I guess it was World Kidney Days last year. So coming up in a week, I guess, will be a year. But what we're hearing is a lot of people saying, oh, yes, and here's some solutions right now to what I could use. Can you send us that? And we never get to the interview piece because they're so excited about it and just say, hey, this is what we could use. For example, can you do a sheet to put up behind, like on our poster board in each of my clinic rooms and stuff like that. So that's what we're hearing anecdotally. Some of the data that we have from our interviews to date are the barriers are obviously classic ones around time and resources. So really working through that and going to go back with strategies that are tailored for those individual settings and clinicians. For the second question about the differences between a multidisciplinary team support versus an individual that is seen and might not have those resources depending on their geographic location or their clinical setup. So what you mentioned in BC is what we heard across the board, across Canada, even in both urban and rural setting. Patients reported, interesting enough, one focus group we did in Toronto was we had people that went to the same clinic and saw some of the same physicians, but got different resources or lack of or more than they needed. So differences within clinics, providers, but what they said is that's where the gap is that we don't have that equal access or equity to those resources until we, as they said, graduate to that next stage of their kidney disease and that progression. And that's kind of where this all kind of stemmed from, was we don't have that until we graduate. So where is this information? Where can we find this? And I should have mentioned right from the beginning is that we've partnered with the Kidney Foundation of Canada from the beginning with this project, because we didn't want to duplicate. We wanted to enhance where the gaps were for the information that patients and caregivers found that they were needing, but yet we want to redirect them to then, all of the great information that the Kidney Foundation of Canada provides. And similar to local regencies, we don't want to replace, but if it can enhance clinicians and patients having that access to more information before they graduate to the next level of care is what was the key to driving this. So thanks for that question. I hope that helped, Monica.
Yeah, thanks. No, that was perfect. Yeah.
I saw somebody had a hand up. Was it Leanne?
It was me, but I realized that it's really more to the potential barriers question, and I wasn't sure if we were doing one question at a time, so I put it down again.
Here, hey, if we want to jump into, and you guys, so you could see what could implementation look like. So I would like to hear from people in the session today, around who you would share it with based on what you saw and what you heard from the work today, how you would share it, what would you share, and then also on the flip side, what are potential barriers? And I'm happy to take comments about either one of those topic areas. So go for Leanne.
Yeah, sorry. I'm just going to turn my camera on here since I'm actually talking to someone. So obviously, like you said, you guys have worked with the Kidney Foundation a lot on this project, which is great because it has really not duplicated and really filled in a needed gap in that early stage. And I know you mentioned it earlier, but I was going to say that one of the biggest barriers, and it's something that we see as well in the resources that we supply, and it's going to be no different, really is language. So like really ensuring that we can address patient populations or have accessibility in language, at least in the 2 official languages, but also recognizing that a lot of underrepresented groups have highly prevalent kidney disease risk and may have specific language needs. So I think in terms of sort of the knowledge translation piece and making sure that we're communicating to the people that need it the most, especially when it pertains to not being able to get resources maybe from their primary care providers because of language barriers, that really is a big one. So something to consider as you move into, and I know we've already talked about it and you've already addressed that, but I just wanted to reiterate, like, that really is something that we've gotten a lot of feedback as well and are working to change sort of for our phase of information providing. So maybe that's something we can talk more about how we can work together to do some of those things. But I think that's a big, huge barrier.
Exactly. And then, that key moving forward, as you mentioned, in terms of addressing like accessibility for diverse populations and language being a foundational when you're sharing knowledge and concepts. So yeah, no, that's a great point. And yeah, high on our list of how we can address that in terms of adaptations within the website or to the website. So the intervention itself, making those, looking where we can do those adaptations regarding.
And it's not a small question either. Like, that's not a small challenge. I'm not in any way suggesting like, oh, you should just go translate this into 6 languages. It'll be fine. No, like we definitely understand the barrier that comes to the team in doing that. But I think it is something that just needs to be kept top of mind as you talk about accessibility.
Exactly, and thanks for bringing it up. And yeah, well, a number one, but also number one big challenge, a big star on it. Yeah, thanks, Leanne. Any other, if anybody would like to speak out, like who would you share it with? Do you feel like in your own clinical setting, do you feel that you would share it now that you've seen it, or what would be the difficulties to share it with your patients, or ideas about sharing it?
I put my hand up for myself, but Anurag, why don't you go first?
Oh, thank you, Monica. Thank you, Dr. Donald. This is Anurag Singh. I'm based in Prince George, Northern BC. So thank you for this presentation. I just wanted to share a couple of things. So we work with a lot of, my practice and our program is based in a lot of rural, remote, and Indigenous communities. And during our discussions, consultations with patients and communities, one theme comes up repeatedly, which is about our patients when they look at website and portals, they feel they can't see themselves in there. They feel as if they're not represented. And it was very recently, it came up again in one of the projects that Dr. Jag Gill is doing with the Indigenous communities. It's called The Bridge to Transplant. So I wonder if you considered some pictorial representations of people or communities or areas so that people feel that the website belongs or represents them. So, I mean, I know in BC, we've tried in all the communication, even the websites, to explicitly make that obvious. But I think that is one important part that came up numerous times, so I thought I'll share with you. The second thing is, when I look at the website, and to Monica's point that people may have kidney disease, chronic kidney disease diagnosed by their primary care providers, and they may, I see scope of this website being used by the primary care interprofessional teams. So they do have teams which, from my understanding, actually need a lot of support like this to help patients at the early trajectory of their disease. So I think, having some references to discuss with your primary care team, because we're, at least that I'm aware of in BC, moving towards a team-based care, even in primary care, that would help to prompt wherever the services are available. So I think that would be helpful. The last comment I wanted to make was, when we explain on the website, and I was just going through the website, it says about when the GFR is lower than 30, like 29, you should see a nephrologist. So, which is the right thing to say at that point, but I almost wonder, they may need to see a nephrologist even for a diagnosis or a consultation way ahead of time. So, if we can, reflect that you may need to see a specialist for a diagnosis earlier than that, so that people don't get delayed, because that's one of our problems. We see people sometimes late in the trajectory of their disease, and if we were to intervene early, it would be good to stratify them, and then they could be followed by primary care or their internal medicine specialist.
Thanks. Those are great points. And you're like, the first one about the representation for Indigenous communities. It's interesting. In our co-development, we had 2 patient partners that were from local Indigenous communities on our team. And interesting enough, that's why the people look purple and yellow, because they said they don't want it to look like, and like they wanted it to be, I guess, I don't know what would be the right term, but basically not look like anybody, like not look like, so that everybody could relate to them. So, but at the same time, we have heard that around content and other features that potentially we could adapt the website to. So foods that are culturally sensitive that would represent different groups. And also like people like themselves. So like, you know, the classic patient stories or something that are there. And so either if that is something we could do within our website, or then refer back to KFOC or any other agencies that do that well already, but good points around that. And we totally agree that there is gaps there in that representation. But interesting that that's how it got translated by our patients and to make these people that look different colors and stuff. The second one about the primary care teams, great point about, and it makes me think about how we, as we disseminate to primary care, but also maybe from the CKD clinics and teams within the CKD world across Canada, is about having this, like promoting this resource. What we're doing is with the CKD pathway that we have developed by our team a few years ago, we're linking it to that too, so that when primary care or anybody that uses the CKD pathway, it will nudge them to go and prompt them to potentially provide that as a resource to their patients. And the third thing about the GFR, less than 30. So we should go back and see what we can change in terms of where we can have that prompt or to highlight that information about if it's in the video or any other places about that, and making that aware, because it's twofold. I think there is one is having primary care understand that when, you know, to refer, but also that patients can promote that through their communication. If they hear it or see it from a resource like this, then they can go ask their primary care clinician about, hey, should I be seeing somebody, you know, doing that prompt, and have more person-centered care in terms of them being at the center of their, and that's part of self-management, right? Yeah, so great. Did I cover everything or address things and make sure I got my notes? So thank you for those suggestions. Excellent, thank you.
And Mo, we just have a few things in the chat talking about opportunities for implementation, like those that do have family doctors and could actually share it with them, using the adding it to all our recommended website information that we give in CKD clinics and in general nephrology clinics and through KFOC resources. And there's some programs that have nurse practitioners that are actually in charge of chronic disease programs in rural and remote areas. So that would be another excellent part. More focus on the common new immigrant languages and those patient populations with CKD. And I think that, you know, when I look at it, I feel that in terms of number one, for easy things we could do, and I think I reflected before we had this seminar, is I don't know who in BC, I have a lot of the BC CKD team on the call, so I don't know whose idea it was, but our clinic has started to put it at the end of our website footer, anything that's coming up in terms of CKD webinars or anything like that. And I must say, adding it as our website footer, email footer, has been one of the best ways to disseminate, better than pieces of paper and others, just adding that on. And we've used that as one of our our quick and dirty, but actually one of our most effective dissemination for those that use email to communicate with patients.
Excellent. No, that's excellent.
Leanne.
From a dissemination standpoint, one of the other things, like from the foundation's standpoint, is we often have other researchers from other areas or other centers looking to develop research programs on, you know, early symptomology or pre-prevention, or, you know, capturing the population that doesn't even realize that they're at risk of kidney disease. And I think maybe helping to build some connections there would also be helpful, because this is such an early stage project. So places where, you know, maybe it doesn't filter into necessarily the resources that we are providing. So that's another place that we've sort of been working on, potentially sharing some of these resources so they can, again, to not duplicate effort, right? If anyone ever comes to us with a project that's doing early preventative work or early access to information, just letting people know what's out there, like having that connection to the full research community, I think is also pretty valuable. And a couple of people have been interested, so it might be something we'll reach out to you about in a more formalized way as things move forward with it. But that's another one, just from the research standpoint than the clinical standpoint, but I think still important. We have a limited amount of resources in the community, so if we can avoid that duplication, it's so helpful for everybody.
Excellent point, Leanne. And yeah, like you mentioned that research community, and through these kind of sessions, it's great because we hear from other people too, be it clinicians, clinician researchers, that there are things that we don't know about that. And so, for example, through CanSolve with the kidney check, a great place to have this for populations that are newly diagnosed. So excellent point, Leanne, about the research community and trying to bridge those connections and how we can dovetail together to provide and support and enhance. But again, we're not there to replace anything that people feel comfortable using within their clinical practice or within their research realm. So yeah, thanks. Any other, I see Selena asked if people that have used it in their practice that responded, the percentage that respond that used it in their practice, any ideas of how you've used it that you can share? Because I'm just thinking back some of what we've heard so far in our implementation stage. Some people have mentioned that so some allied health saying that this is perfect, that they can introduce it and then they know they're having a patient back again, that they will then follow up with their patient and have it on the screen. So there's opportunities there to share this website for even populations that might not have daily access to the internet or the internet or medium like a computer or mobile device. So they said that this is a good way, and then they can print some things off for them from the website. So things like that, they've used it that way, where there's a gap in terms of, for a better term, like a digital divide for some of the populations. So they've been thinking about ways to do that for some of their populations.
To me, one of our challenges will be how to get this in the hands of the people who need it that aren't going to CKD clinics. Mm-hmm. And I think that's something that we know our renal community so well, but it's going to be quite the focused effort. And I don't do this often, but maybe to my physician colleagues, when I send out a dictation and tell people that I don't have to see the patient again, but this is what I'd watch for, I don't often add the patient information, and often the reason they were referred to me at early stage was because the patient wanted reassurance. And so I'm reflecting that might be something I might want to do, is add it to my dictations back for those early stage patients as somewhere that patients might be able to go themselves to get that information. And then the GP feels that they, or nurse practitioner feels that they really could give people wholesome information. So that's just something that I've been thinking about during your presentation.
Thanks, Monica. And it makes me think about some of the suggestions around how the messaging is to link to the website. So a QR code, 2 years ago, we would never have we would have heard the QR codes for this population, like, no, right? But now, everybody is used to a QR code and how to use it. And so this is something that, obviously a negative thing about COVID-19, but also what came out of it is QR codes that people are suggesting that this is a way to pass it along besides, the direct link to it, the URL. So other ways of visually presenting the connection or link to the website. Any other thoughts or concerns about the website itself? Challenges? A big thing I know, and Leanne probably would comment on this, is this dissemination. I know when we were going across Canada and interviewing patients and caregivers, and I was very fortunate to meet up with clinicians that worked in different CKD clinics in different provinces, and also some of the KFOC local chapters. And interesting enough, that whole thing about handing out patient information, like, you know, the books, like book 1 and 2, you know, like there's, I remember having a conversation with some KFOC staff about, yeah, like how do we, like, what does that look like? It's not consistent. They, you know, they don't know how many of those get handed out. And now it's great that they're electronic versions too on the KFOC site. But I think this overall concept of patient information or patient tools and resources is a tough one to put into our head around about how we do that. We see that a lot of clinicians are easy to uptake a clinical tool to help them, but it's about how do, you know, we integrate a patient-facing tool. And we hear the same in primary care from clinicians there, like more, not so much with the allied health, but with the physicians, you know, it's around time, you know, it doesn't pop into the mind to do it at the time, or things like that. It's not natural for their behaviors to provide that at that moment at point of care type of tool. So is anybody using other websites that they share or other resources that they share, like local ones, and any comments on that you're sharing with your patients? Pretty quiet group. Okay.
So there's a
thanks.
comment
Yeah.
in the chat.
Yeah.
Yeah. So local renal websites like BC Renal. Yeah. And the Kidney Foundation.
Excellent. That's excellent, because those are, if you look at our resources and references on the website, thanks to experts that clinicians from across all provinces helped us where we had those gaps, that patients said there's not enough information on this or that. And we're very thankful for these resources that were already out there that we could refer to or supplement to. And provincial agencies, thanks Leanne, like the KFOC, yeah, and provincial agencies. Manitoba Renal, okay, great.
I would say the biggest implementer is probably not us. It's Dr. Google, right? So to me, for the patients, if patients are savvy, that's probably our most important implementation tool, is that it comes up, because no matter what we give the patients, they're gonna look. And so if it's situated in a way that shows that it's supported by most of our programs or all of our programs in Canada, so that kind of branding to show that this is a legit site that we find important, that's where most patients are gonna find it, right? Even if they get it on a card or on something, that card's gonna get lost and they're gonna Google.
Mm-hmm. Interesting, Monica. So we track our Google Analytics to behaviors of where people come from, like, and how they enter the site, and obviously what they use on the site, and what's of where they spend more time on the site. And so we track that monthly. And it's interesting, like you said, people that Google. So we have when we bring the website together in terms of the technical build, is making sure that the terms, like, it was interesting, the terms we had put together as either clinicians, researchers, and then what patients told us that what they use as their terms. It was so we had to flip it, right? Because the language, we were, oh, you know, renal disease, this, that, right? But the patients came up with, and so that's why in terms of the website, the content has been written in terminology, obviously plain language, to meet website accessibility criteria that we follow, but it was written in replacement to what patients, so when it's tagged, when there's a Google search, that it will come up. And like you said, in terms of credibility, we also use the Hong code, which is the health on the net, in terms of making sure that it follows all the health criteria. So that's next slide, I guess, is in terms of our, as we wrap up here, but please put any comments or email us. So our next steps are, if you want to learn more about the project, please go to the CanSolve. We have all our phases of work there, and our research from it. Explore the website, share with your patients, and even share with us, like, these, if you're using, go, okay, you know what, this should be changed, or because we have to also keep up with ensuring the information is up to date and timely, and so all those things. Follow our research group on Twitter, and then if you're interested in supporting this research or be involved going forward, or being part of an expert group to keep us keeping the content up to date, be it in the areas of social work, the dietitians, pharmacy, let us know. And you can email Sabrina. Next slide, please. And so basically, huge acknowledgements to both our patient partners through this journey over the years, but our patient participants and caregivers who have worked. And it's interesting, some of our participants were so interested in the work, they became patient partners. So it's interesting how that works if they find an area of interest, and they become involved in the research themselves. And thank you to the CKD self-management research team in terms of, I know Sabrina and Sarah on the call, and Selena and the CanSolve team are very supportive, and obviously the funds from both CanSolve and SPORE for this patient-oriented research project. Next slide. And then I think that's it. If there's any questions, again, you can contact Sabrina, myself. I'll throw out Selena's name there too. But again, thank you for the time to present to the group today. And we look forward to any type of feedback that how we can improve what we're doing, and any interest to go forward with this work. And thanks for the comments that have come in the chat, and the comments that people came off mute and provided. Excellent.
That's great. Thank you, Mo. Thank you, everyone, for signing on. We hope to have your numbers kind of tick upwards with your analytics as we get the website in the hands of the patients who want it to help their health. Yeah. Thanks, everybody.
Thanks, everybody. Have a great rest of the week.